Good afternoon and welcome to the April 2021 Dr. Fazil Show. We have Dr. Fazil here with us today, and we'll be discussing a little bit more about the COVID-19 virus and where we're going with it for today.
Yeah, so that's thank you audience for watching this show, and I hope everybody's doing fine. Um, uh, as Wendy said, the topic for today's discussion in this show is obviously the updates on COVID-19 epidemic. So I think things are looking relatively good in one way, that we have less hospitalization and less death rate from COVID-19 infection due to very smart moves. We have adapted early in the pandemic, like designing the vaccine and then implementing it through Operation Warp Speed and using FEMA to inoculate patients. So we have around 123 million vaccine given so far, and we are in April, so that's a very good speed. But again, remember, these are 123 million vaccines, not patients, because some of them are getting twice as much. They have to take 2 doses, and based on what kind of vaccine they're getting. So I think 20% of the U.S. population is already inoculated at this time, and there's 20% is the high risk population, which was inoculated first. So that has changed the national pathway of this pandemic dramatically in the USA.
Is there a specific age group that we are seeing increased numbers of the COVID-19?
Yeah, so we call it the fourth wave of COVID-19 now. As logically speaking or thinking, people who didn't get infection are the age group which are in 30s and 40s, and they're the one who are actually more active physically, and they're out there working, and also to some extent they have less tendency to use a mask, and because of that reason it is isolated that group from the high risk group, and they are getting more of this infection because they never got vaccinated in the first place. Plus they have a relatively high risk behavior. Combine those two factors, we're seeing another pandemic or shape of pandemic. I will call it fourth wave, and mostly people are calling it the fourth wave. It's not a new strain. We thought the new strain is going to cause a lot of issues. Fortunately that didn't happen, so that means the vaccine which we have given initially is still active against the new strains coming from UK and from different countries. It is still active against those new strains as well, which is a good news. We wanted it that way because it's a very powerful vaccine. So Moderna, Pfizer, Johnson and Johnson, and I think there will be that fourth wave will go away once we start to inoculate them, and the projection is by September of this year we'll have 75% of U.S. population all vaccinated. That will give us to the next stage of herd immunity, and I think after that we should be fine.
So is that 75% of the adult population or the entire population?
That would be our entire population. Yeah, so I think the way I'm looking at it is that to lower the chance of getting sick or hospitalization or giving less stress on the hospital system, we have to follow the pathway, to give the patients which are high risk, which we already did, and now we are finding out that there's another group of patients which are getting infection. So the next phase is opened up where they're getting inoculated now, and I think by in the next few months the children should also be vaccinated or would be vaccinated, and once that happens, based on the map or growth charts, we're looking at September of this year or November of this year. Everybody should have been inoculated in the USA, one way or the other. So that will be end of pandemic for USA. Obviously, there are other countries which they're still struggling, and there are various reasons. We see in Europe, like in Spain, Italy, England, Germany, they have banned or stopped using the AstraZeneca vaccine, and they have another lockdown. Um, um, why didn't they use the Johnson and Johnson or Moderna? Maybe there was a shortage. Maybe it was a economical issue, but they end up with using this Oxford AstraZeneca vaccine, which apparently have some intrinsic side effects of causing blood clots. So those blood clots are could be life-threatening. They can travel from the legs to the lungs and cause choking of the chest and shortness of breath and certain death. So because of the higher risk and higher incidence of association of those blood clots with this AstraZeneca vaccine, they have put a hold on its use in the European country, and even in Asian country like in Thailand, they also stopped using it there too. So I think the future will unfold the next chapter in this book, like what would be their strategy. I mean, obviously if they follow the same strategy as we did it here, they will have the same results. The problem is, can they do it, and I think all depends at the end of the day is what about the infrastructure they have, and what kind of financial system they are able to afford this kind of novel vaccine which we have used in USA. So this is unfortunate in one way, but also we are fortunate that US is a very powerful country, and even with this kind of pandemic, we were able to handle it pretty quickly and pretty fast, without a major loss of lives. Although there were a lot of lives have lost, but under the circumstances, I think it is still we are in a good shape.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Just to clarify to our audience, the United States did not use the AstraZeneca vaccine in any of our
No, they're
population,
still
correct?
waiting for the approval, and I don't know how they're going to get the approval, because if they have bad outcome in other countries, they will have to do some changes, some modifications, get approval, because in the USA we have a very rigorous standard with the FDA and CDC. They don't just pass any vaccine. So that's why the vaccine which was passed, although they were passed for emergency use only, which are actually, when we say it's for emergency use only, it bypassed a lot of red tape, for approval. So the government had to use certain maneuvers in USA to get the vaccine in the people's arm, but it did work. So in other nations, unless they do the same thing, I think that the virus is going to stay around there for a long time. Yeah.
So Dr. Fazil, as we are vaccinated, how much longer will we have to wear the mask even if we are around other vaccinated persons or people?
Yeah, so logically thinking, if you follow the common logic, um, if you're vaccinated, then somebody else to use a mask would become not a relevant thing. But the answer to this question is like that person would be exposed to multiple people in short period of time. How would they know what person got vaccination and one person does not got vaccination? So they might say this person got vaccinated, and then they go to outside or do something else, or somebody else pass by and they sneeze on him, and he was not vaccinated or she was not vaccinated, and now he got it, right? So since it is not, there's no stickers, there's no passports, there's no marks that this person have got a vaccine, so I can I can be with that person without the mask versus somebody else, a random person. Since we don't know that yet, so we still have to use the mask.
So is it safe to say, with familiar people in the small groups, if you know that your group has been vaccinated, is it safe to be around that small group without a mask?
Yes, and I think there's a small risk of variation of mutation. Well, I mean, if you want to be 100% safe, yes, use a mask. If you want to, the idea is obviously to stop using the mask and no lockdowns and go back to normal life, and that's the whole idea, right? So you got to start from somewhere. So maybe yes, if it's in an extreme controlled environment where we know for sure everybody got to have vaccinated, I think with the precaution, mask might not be necessary. So, but then there's another hidden question: how long the vaccine is going to work? Because we have seen that in the natural history of the vaccine, if you get vaccinated, I mean, if you get infection, you get immunity for 4 months. So my understanding would be, if it is with the real infection, you're getting 4 months. Then with vaccine, you should have probably the same amount of time. So the question is, if you got in April, in next 4 months, your immunity would be over. What next then? So that is a thing we don't know yet. And then they do, the vaccine manufacturers have recommended that checking, getting a booster shot. So since we are not even at the first phase yet, like we haven't vaccinated more than 20% of the US population, the booster vaccine is not in question at this time. But I think once we have vaccinated everybody, and at that time, we will have to see that if the immunity start to decline, just like we have seen in other, like in measles and mumps and rubella,
right,
and flu, nobody get one shot forever and, they get good forever. I mean, this is not even the casual infection. They need booster shots, and we know that. So I would definitely expect this will at least need some kind of booster shot somewhere, either yearly or semi-annually. That would be based on the precautions we take when people come to USA. Are they bringing in new infections? Have they been inoculated? Have they been checked for those infections? Because if you don't follow that precaution, then it defeats the purpose. I mean, we keep bringing more infections, and so I think is a dynamic situation. It is not a simple answer to your question. The time is the key that will tell us the ultimate outcome. We're going to do what we can do, and then wait and watch and see what happens. But the mask thing is that, yes, if you want to be 100% careful, keep following the social guidance. Distancing, the change from 6 feet to 3 feet now, and then also sanitization, which is actually a standard precaution for anything. I mean, it's not like this for COVID. I mean, if you have, there's so many infections out there, so to avoid all that, sanitization is still recommended. I mean, this basic hygiene is not too complicated. I think we're stuck with the issue about the mask, and the answer is I don't know the answer yet because there's two things we don't know yet. Number one, the loss of immunity in 4 months. B, a new vaccine, new infection coming from people who are traveling back to USA, and if they're not checked or being vaccinated, then they will be like a super spreaders, keep spreading the infection. So I think that hole have to be plugged. That need to be plugged, and then we look at the question of booster shots, and I think the booster shot is definitely going to be needed based on the other infections. I mean, I'm just going based on other infections like flu vaccine, even the tetanus. You get some infection need less time frame between the booster shot. Some need more time. Like shingle vaccine need 5 years. Flu vaccine need a yearly booster shot. Pneumonia vaccine need like every 5 years. So this is going to be at least yearly, if not more often, once we get to that level. But again, that's the next level step. We're still at the early stages.
Okay.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
And do you think the manufacturers, the pharmaceutical companies are already working on a booster shot?
Booster shot would be like exactly the same what it is.
Exactly the
So
same
there's no
one.
change. I mean, it's just another extra shot. Booster shot have no difference than the original shot. It is just the time. So let's say you're getting 1 day, and then on day 14 for a certain vaccine versus one shot. And then in 6 months, I think we'll have to look at some kind of study need to be done, which will look at like people who got vaccine, what is their antibody levels, and if they're still immune or not, and what would be the right time to start introducing the booster shot.
Okay.
But again, I think once the system is established, I mean, if there's surplus vaccine, booster shot wouldn't be a big deal. I mean, we already have infrastructure in place, pharmacies are giving it, the FEMA and a lot of a lot of other places they've been delivering. Even the doctor's office, some doctor offices are giving COVID shots. So we already have that supply chain system in place. So I think the booster shot wouldn't be mission critical. Would be important, but wouldn't be mission critical. Yeah.
And should run a little bit more smoothly now that we have the groundwork laid out?
Exactly. Yeah.
Okay.
People have a less phobia about the vaccine. I think that was hurdle to get people to understand that it's not a hoax, and I think that was the main thing. And then letting them believe there's no microchips in there. That was second, educational level, and third is like believing in the vaccine that is going to work and that's not going to is not going to cause a lot of side effects. And I think that people have legit reason to question what we're injecting in their arms.
Right.
I mean, obviously, they're all adults. We all, people have questions. Those questions need to be answered. And but with time, they have seen people dying from COVID, and they also have seen people being saved by COVID vaccine. So truth speaks for itself, and that's why I think it's like a domino effect. So as people are getting better and they're seeing the good response, they're getting more, I would say, believer in the vaccine. And I think it like in a medieval time, if there was a plague and somebody come with a treatment like penicillin and say, hey, I got penicillin and I'm going to cure everybody, and people will say, oh no, we're not going to get it. We might get is like some kind of like a black magic. We're not going to have it. And as an outsider, what would you think about that mindset? You'll say that's dumb. I mean, people are dying in this treatment. Why would you not take it? But obviously the time frame changes, and now we're here. But the logic remains the same. 100 years later, people would have talked. Hey, they had the COVID going on, they have the vaccine, but they didn't want to take it because they thought there were some kind of microchip in there, and it was bizarre. But fortunately, that didn't happen. So I think that's a moot point now. But it was kind of a big issue initially, but we came far along. So I think we're getting out of it soon.
Okay.
Yeah.
And do you anticipate the COVID vaccine being one of the required immunizations, like normal childhood immunizations?
That's a good question. Well, we have to think that way. COVID is not a children's infection. It's mostly for adults. Certain vaccines are given to certain people. Right now we're covering the basics, so everybody's getting it. But for children, being a routine COVID vaccine, since they don't generally get sick or symptomatic, making it mandatory for them, I don't think would be an issue, would be an agenda. But the question is that they could actually have it and then spread to their parents, which are at higher risk. So that might be another reason to give vaccine to the children, so they don't bring it to parents at their home or teachers in the school, because they're the high risk. And to prevent that cycle, that it might become a mandatory vaccine for children. Unlikely, as I said, because we're like in the middle of the pandemic. So it's like we have to make our priorities straight.
Okay.
What are the priorities at this time? So I think we have to go from covering the basics, which we did 20%, then giving booster shot issue. We haven't addressed that issue yet, and we haven't addressed the issue like the newcomers. What are we going to do with them? Like how we're going to, what is the system in place to check for infection when they come to the country?
Okay.
And are we going to vaccinate them right there and then before they depart, or we're going to just quarantine and then do vaccine? I mean, those are the two other questions we haven't answered yet, right? Booster vaccine, and then the immigrants or travelers, I will call it, either immigrants or travelers. If you're traveling for just as a tourism, we need to know like what is the vaccination status, if we need to stop and go back to normal. So those two questions need to be answered, and then have some kind of system need to be in place where immigration or tourism, people coming in through that route, they need to be checked for antibodies and get vaccinated appropriately if they are not vaccinated, and they need to be vaccinated. So we have to take more steps to control this giant. But at least we're heading in the right direction.
Right.
It's not as fast as we thought it was going to be, but again, this is global thing. It's not just a local thing. So
the light's a little bit brighter at the end of that tunnel.
Yes, the lights are getting better at the end of the tunnel every month. So I think we're going to be in a better shape next month, and month after month, that month, and hopefully by again, there's a possibility if we follow all the steps which we discussed now, we should be able to get out of the mass situation by end of this year. It's possible, at least in USA.
Right.
Now the whole world is a different story. I mean, again, that is like a unknown territory, because we have developed countries and we have underdeveloped countries, and we don't have data from them. Actually, we don't even have our data. So this is we're talking here about based on the available data, so we have a good grasp on the pandemic. But like in different countries, like in Asia, in India, Africa, people just die. I mean, they don't have any definitive diagnosis, like why did they die. So it could be COVID, it could be anything else. So obviously they have a bigger battle to fight, with very limited resources and a whole lot bigger population to work. So I think that is a totally different picture. So I hope they get WHO helps them out. I hope the developed countries help them out, and it's a total humanity effort. It is not just one person alone. It is they say if you have to go faster, you go alone.
Right.
You want to go further, you go together. So I think that's the goal for this pandemic, is that everybody have to go together, and that's the message for today.
Thank you very much. Thank you for joining us this afternoon for our April 2021 edition. We look forward to talking with you again for May of 2021. Thank you so much, and stay safe.
Thank you, audience, for watching this show, and we will be back next month with hopefully even better news. Stay safe, God bless, and see you next month.
Thank you.